Goals of learning essentials of diabetes. During the following presentations, you will learn that what is diabetes, blood sugar or blood glucose, which is the right term and what is the difference. Why does diabetes occur? What is the relationship between glucose, cell and insulin? What is the role of insulin in control of blood glucose levels in different types of diabetes? You will also learn about various types of diabetes, including type 1, type 2, also called T1 and T2, and other types of diabetes. You will learn that who is more likely to get diabetes and why. You will also learn symptoms of diabetes due to high blood glucose levels and symptoms of diabetes due to lack of glucose in the cells. Here are the presentations. Let's discuss about diabetes. What is diabetes? There are many ways that one can reach the diagnosis of diabetes, and we will describe 3 common ways that one can reach a diagnosis of diabetes. If somebody has symptoms of diabetes, and we will talk about these symptoms later on, but if somebody has symptoms of diabetes and if his or her blood sugar is checked and if it is more than 200 milligram percent, then it is diabetes. This sugar, which is checked without fasting, is called a random blood sugar. So if somebody's random blood sugar is more than 200 milligram percent, it is diabetes. The second way that diabetes can be diagnosed is you ask the patient to fast for 8 hours, and during these 8 hours the patient should not eat or drink anything, should not even drink water, and then give a blood glucose test. If this test comes back showing a value of 126 milligram percent or more, then it is diabetes, and it is recommended that this should be confirmed on one more reading that the value is 126 milligram percent or more. The third way to diagnose is you give the patient glucose to drink. Suppose both those tests that we talked about earlier do not show diabetes and you strongly suspect that the patient may have diabetes, then you give the patient 75 gram glucose in water to drink and then check a blood sugar again. If after 2 hours of giving this, the blood sugar is more than 140 milligram percent, then it is diabetes. So we talked of 3 different ways to diagnose diabetes. The protocol or the way that is most standard to diagnose diabetes is that you ask the patient to fast for 8 hours, and during these 8 hours the patient should not eat or drink anything, not even water, and if the blood report comes back as 126 milligram percent or more, then it is diabetes. Then what is the normal blood sugar? The normal blood sugar is below 100 milligram percent. That means it could be 99, 98, 95, 91, up to 70 milligram percent. That is normal. So the normal blood sugar after an 8-hour fast is 70 to 99 milligram percent. So what happens if the sugar is between 100 and 125 milligram percent? These cases are said to suffer from a term pre-diabetes. Pre means a step before. So the term is self-explanatory that a fasting blood sugar between 100 and 125 milligram percent is pre-diabetes. So to recapitulate, normal fasting blood sugar is 70 to 99 milligram percent. Pre-diabetes is when the sugar is between 100 and 125 milligram percent, and it is diabetes if the fasting blood sugar is 126 milligram percent or more, and it is also recommended that this high reading should be confirmed on one more occasion. Personally, I do not feel that is necessary. If the sugar reading is quite high, it is diabetes. One thing to remember, that before you give this test, do not take extra precautions of fasting or something other than these 8 hours. That 72 hours before you give this test, for 72 hours eat a regular meal, eat what you have been eating regularly, so that the report really reflects what your blood sugar reading is. Now recently a fourth test is added which I strongly support and I have supported for so many years, and that is called A1C. A1C is an average of your blood sugar readings in the last 3 months. And why I have supported this test is the reason that when you give a fasting blood sugar, that sugar reflects 1 second out of 84,000 seconds in a day. So your sugar could have been perfect in the morning, but it may have been high in the afternoon or evenings. And because A1C gives an average of the past 3 months, if the sugar was higher towards afternoon, evening or night, it will reflect in A1C. We will talk about a separate presentation on A1C, but suffice it to say that normal values for A1C are between 4.5 and 6, and they vary from lab to lab. However, if the value is above 6.5, then there is a strong reason to believe that the patient has diabetes. So I hope you understood these 4 methods or 4 ways to diagnose diabetes. We will talk about all these parameters that we have discussed just now in much more detail. We will see what is the difference between the term blood sugar and blood glucose. We will see what is A1C, how it is formed, what is normal, what is high, and what to do if it is high. We will also see that how the sugar goes higher in some cases while not in others, when they are living under the same roof, eating the same food every day, why some people end up getting diabetes and others don't. So there are so many important things that we will discuss, but suffice it to say at this stage that a fasting blood sugar of 126 milligram percent or more is diabetes, and a fasting sugar of 70 to 99 milligram percent is normal. Now let's talk about 2 terms that confuse a lot of diabetic patients, and these terms are blood sugar and blood glucose. What is the difference between sugar and glucose? There are many types of sugars in nature. Milk has lactose, fruits have fructose, and sugarcane has sucrose, the common sugar we add to tea, coffee, and sweets. All the sugars, if you break them down at the smallest level, are made up of molecules of glucose. So glucose is like a brick and the sugars are like a house. With the same brick, arranging them differently, you can make different types of houses. So arranging the same glucose in different forms, you can have different types of sugars. So different types of sugars that we eat are broken down to glucose before they circulate in our blood. So our blood only has blood glucose, there is no sucrose, there is no blood sugar, there is no blood fructose, there is no blood lactose, it's only blood glucose. So if blood glucose and urine glucose is the right term, why do we use the terms blood sugar or urine sugar? The answer comes from knowing the history of diabetes. Many years ago, doctors saw that some patients passed a lot of urine and they labeled the condition, they named the condition as diabetes. In those days, tests were not available. So somebody had the courage of tasting the urine of these patients who were passing a lot of urine. And they found that some of the urines were sweet and they called them melichuria. Melichuria means sweet urine like syrup. So those patients who had sweet urines were diagnosed to have diabetes mellitus. Now with time, various tests were developed and then we came to know that the sweetness in the urine of a diabetic is not from sugar but it is from glucose. So the right term was urine and blood glucose. And what happened, because we have used the term sugar for so long, it became a common practice to use the names interchangeably. So when we are talking about blood sugar or urine sugar in terms of diabetes, we are really meaning blood glucose and urine glucose. So as far as the diabetic is concerned, as far as the urine and blood testing is concerned, the word glucose and sugar are synonymous, they are the same, and they really mean glucose. Maybe after a few years, after a few decades, the glucose term will be the only term that will remain. Instead of blood sugar, we will talk of blood glucose. We already started talking of glucose like glucometer, the meter that checks glucose. So these two terms are one and the same. There's no need to worry or get confused about these two terms. Another point here, when we use the word diabetes, we mean diabetes mellitus, because the other type of diabetes, which is called diabetes insipidus, occurs very rarely. More than 99.99% cases are because of diabetes mellitus. So when we talk of diabetes or when we use the word diabetes, it means diabetes mellitus. Diabetes insipidus happens in cases of brain tumor and other brain problems, and it has nothing to do with blood sugar levels at all. So do not be confused by the word diabetes and diabetes mellitus. They are used again interchangeably to mean diabetes mellitus. So we clarified two sets of terms, in diabetes, in terms of testing, blood sugar, blood glucose are the same, they mean blood glucose. Urine sugar, urine glucose are the same, they mean urine glucose. And diabetes mellitus are the same terms, they mean diabetes mellitus. Now let's see why people get diabetes. To understand this question, we have to understand three facts. The first fact is much of the food that we eat is ultimately converted to glucose and circulates in our blood as glucose. The second fact is that our body is made up of many systems, like gastrointestinal system has liver, stomach, intestine in it, and many other organs. Our cardiorespiratory system has heart, lungs, and blood vessels in it. The nervous system has the brain, the spinal cord, the nerves in it. And the musculoskeletal system has muscles, joints, and skin and related structures in it. So the body is like a combination of many systems. Like a car is a combination of many systems, our body is a combination of many systems. Now, if we look at each organ, then we will see that at the smallest level, each organ is made of cells. Cells are very, very small in size and cannot be seen by the naked eye. We need microscope to see the cell. To give you a brief idea about cells, a pinch of my skin will have millions of cells. So you can imagine the size of the cell, how small it is. And here comes the third important fact. All cells need glucose to function properly. So the brain cell needs glucose to think properly and do other brain related functions properly. The heart cell needs glucose to pump properly. The liver cell needs glucose to make enzymes properly. So it goes on and on, but ultimately all cells need glucose to do their function properly. Now, to be able to use this glucose, the glucose need to enter the cell. So if this is the cell, this is the glucose need to go inside the cell so that the cell can use it. The entry of glucose at the cell level is helped by something called insulin. So insulin helps the glucose move into the cell. And if there is lack of insulin or absence of insulin for any reason, this glucose will not be able to enter the cell. This will have two outcomes. One, that the glucose levels in the blood will rise. And we know once they cross 126 milligram percent, once they become 126 or more, we call it diabetes. So the first consequence of the glucose not being able to go inside the cell will be that the blood levels of glucose will rise. The second consequence or result of glucose not entering the cell will be the cells will feel hungry for glucose because they are not getting glucose anymore. And the cells will not be able to function properly. They will not be able to do their job properly. So the brain cell will not be able to think properly. The muscle cells will not be able to move us easily. There will be easy fatigue and tiredness, and we will discuss symptoms of diabetes in detail. But suffice it to know that because there is deficiency of insulin or absence of insulin, the glucose cannot enter the cell and the levels rise in the blood, giving some symptoms of diabetes, and levels decrease in the cell, giving some other symptoms of because of lack of glucose inside the cell.
This is a cell and this is a blood vessel which carries blood. The blood vessel has blood in it which has glucose in it. Now this glucose need to go into the cell so that the cell can function properly. At the cell wall shown here in this brown circle, there is something that is needed that helps the glucose enter the cell, and that something is called the insulin. Insulin is a hormone which is made in pancreas, which is situated in the upper part of our abdomen. In conditions where there is no or less insulin than required, as shown here, the glucose cannot enter the cell and stays in the blood vessel. As a result, the blood glucose goes up as shown here, and the glucose in the cell goes down, and these two cause various symptoms of diabetes. So this is a very important diagram. This is a cell, this is a blood vessel, this is the glucose that has to enter the cell. Insulin helps the glucose to enter the cell. Insulin is made in pancreas. If for any reason the insulin is absent or less than what is required, then the glucose cannot enter the cell, accumulates in blood causing high blood glucose levels, and the levels of glucose are low in the cell and the cell cannot function properly, and these two give rise to various symptoms of diabetes.
Now let's see what is insulin. Insulin is a substance that is produced in pancreas. And what is pancreas? Pancreas is an organ in the upper part of our abdomen, and it lies just behind and below the stomach. Pancreas is the only place in the body where insulin is produced. Now, why is that important? If the pancreas is damaged or removed for any reason, then we can easily understand that the patient will develop diabetes. Because of lack of insulin, we saw the glucose will not be able to enter the cell and the blood levels will rise. Now, insulin is a substance that is created in very, very small amounts, and it is called a hormone, because even though it is made in pancreas, it goes in the whole blood and helps all our body use glucose. Now, in conditions where there is total absence of insulin, as I said, when the pancreas is removed or when the pancreas is damaged, as we will see in type 1 diabetes, then the only treatment is giving insulin from outside the body, giving insulin as injections or inhalers. But that type of diabetes where there is total absence of insulin cannot be treated by tablets. Compared to this, if the pancreas just cannot supply sufficient insulin but can supply some insulin, then we can give tablets, number one, to push the pancreas to make more insulin. Number two, to make the insulin available more efficient. that the insulin's action at the receptor on the cell where it helps glucose enter the cell can be improved. And that we will see is what happens in type 2 diabetes. It may be that initially the pancreas was weak and was still producing some insulin, so the patient could be treated with tablets. But with growing demand or increasing age, the pancreas becomes so weak that it cannot provide any more insulin, and then even these patients with so-called type 2 diabetes will end up needing insulin. We will talk about different types of diabetes in another presentation. Now, many a times I see patients with type 2 diabetes who are well controlled on tablets, and then their doctor tells them they need insulin and they don't want to take insulin. They think insulin is a bad thing, and why can't they just continue with tablets? What happens is that with time, these patients' pancreas has become so weak that all the tablets that you can give cannot make it produce enough insulin that the body needs. The damage doesn't come from insulin, the damage comes from high blood sugar levels. The complications that we will see that occur in diabetes come from blood sugar levels. So whatever you need to take, whatever you need to do is immaterial. The bottom line is that your blood sugar levels should be well controlled. We will talk about those levels, that what is a well controlled level, fasting and after eating food in diabetes. But as far as the question of taking tablets or insulin injections is concerned, it is irrelevant. Currently available insulin is very safe. It is synthesized artificially, so it's very pure. In the past, insulin came from the pancreas of the pigs that were slaughtered, and it had some protein impurities. But now the insulin that is available is almost free of all side effects and impurities. Insulin can cause low sugars, that is its normal function, but otherwise insulin is very safe. So please do not hesitate to take insulin if your doctor recommends that to control your blood sugar levels you need insulin and the tablets will not work anymore, or in addition to tablets you need to take insulin. Listen to that advice. The bottom line is your blood sugar should be under control. Whatever you take, dietary measures, exercise as per your physician's advice, tablets, insulin, whatever, herbal products which are safe, but the bottom line is the sugar should be under good control. Now let's see how many types of diabetes are there. Essentially, there are two types of diabetes. First is called type 1, where there is total absence of insulin. The second is called type 2, which starts as a relative absence of insulin, and we will discuss both of them in detail soon. Other types of diabetes include post-surgical, where the pancreas is removed by surgery and so there is no insulin available and that causes diabetes. Pregnancy diabetes, or also called gestational diabetes, where the diabetes occurs for the first time during pregnancy, disappears after the birth of the baby, and in many cases it may reappear as a full-blown diabetes later on in life, and we will discuss this topic separately. Some medication like steroids, when given to treat asthma or rheumatoid arthritis or such chronic conditions, can cause diabetes because they interfere with the glucose metabolism. So these were uncommon causes of diabetes, but the common types of diabetes are type 1 and type 2. Now let's see what is type 1 diabetes. Type 1 diabetes, also called T1 diabetes, happens in younger people who are below 25 years of age, is more common in Caucasian or white people. The exact cause is not known, but it appears that either an infection or something called autoimmune process damages the pancreas where it forms insulin, and as a result these patients have total absence of insulin. There is no insulin available in these patients. As a result, we can understand the only treatment that is available for these patients as of now is giving insulin injections. There have been some trials of giving insulin as inhaler, and that's not a common mode of insulin administration yet. So type 1 diabetes happens in younger people below 25 years of age. There is no insulin, so the insulin need to be provided from outside the body, and most probable cause is either an infection or autoimmune destruction of the pancreas where it forms insulin. So these patients also have antibodies, something called antibodies, which damages pancreas in their blood. So if you check their blood, they will have antibodies, and that will become important when we talk of another type of diabetes soon. Because there is total absence of insulin, these patients are more likely to get high sugars, and because they need big doses of insulin to control their sugar, they are also more likely to go into low sugars. So they can get very high sugars, they can get very low sugars, so they are a challenge to treat sometimes. Also, because these patients are young, it is difficult to manage the diet and the nutrition because they are in college, they are in school, they are playing, they are active, and all those things affect the blood sugar level. Now let's see what is type 2 diabetes. It is also called T2 diabetes or T2, and in this type of diabetes there is a relative absence of insulin. So the insulin is there but not as much as is required. As a result, these patients can be treated in many different ways. Let me explain that. Suppose a patient weighs 180 pounds and needs, for example, 180 units of insulin. But the body can only make 160 units of insulin. As a result, these patients are deficient by 20 units. Now, here is where options come in play. Either we can supply extra 20 units of insulin as injection to these patients, and then their need for insulin will be met, or we can push the pancreas by giving some tablets daily that the pancreas makes more insulin, and now the pancreas where the insulin is made is stimulated, pushed to make 180 units so that they can meet their daily demand for insulin. The third way is that we can make the available insulin work more efficiently. So even that 160 unit which is there, will be able to do the job of 180 units. The fourth option is that if the patient loses weight and comes down to say 160 pounds and then he needs 160 units of insulin, and these are imaginary numbers, but this is to give the example, then this patient will not need insulin anymore or will not need any treatment for diabetes anymore because the patient has enough insulin in the body as required by the body. We will talk about various approaches to treating diabetes in a separate presentation, but suffice it to know that type 2 diabetes occurs in people who are over 35 years of age. Many of these patients can be slightly or significantly overweight, because when you have more weight you need more insulin, and if the body can not produce that much insulin, you get diabetes because of deficiency or lack of enough amount of insulin. These patients' diabetes can be treated by dietary management, by weight loss, by physical exercise. If it's a mild diabetes, it can be treated, or even if it is significant diabetes, it can be improved by taking these measures. Compare this to type 1 diabetes. Those patients are not overweight. They have absolutely no insulin. So all these things, dietary modification and exercise, will not control their diabetes. Of course it will help, but basically type 1 diabetics will need insulin. Type 2 diabetics can be managed with tablets, or if it is very mild, type 2 diabetes can be managed by dietary modification, exercise, and change in lifestyle. Now the question comes, can type 1 diabetes happen in older patients who are more than 25 years of age? The answer is yes. In rare cases, and it is very new, it is just being studied in detail, that if some patients where the pancreatic damage started late, then these patients can have type 1 diabetes even if they are above 25 years of age. The distinguishing feature will be that they will have antibodies against pancreas, just as type 1 patients had. Type 2 patients do not have antibodies against pancreas. So these patients who develop type 1 diabetes at a later age will have antibodies against the pancreatic components, and now they are being labeled as diabetes type 1.5 or T1.5. You will hear this term probably more frequently in the future, but the number of these patients is very small. These patients, because they are above 35 years of age or above 25 years of age, may be started on tablets, but very soon will need insulin because there will be a rapid decline in pancreatic function and rapid decrease in insulin levels, which will go down to zero pretty soon, and so these patients start requiring insulin very early. Now another question, can type 2 diabetes happen in younger patients? And the answer again is yes. We saw type 2 diabetes is because of a relative lack of insulin. So if a young child, say somebody who is 18 years old and weighs 300 pounds, and the body can only make up to 250 units of insulin, there is a limit to what body can make insulin. So if the body can only make 250 units of insulin in a day and the person weighs 300 pounds, then there will be a gap or lack of 50 units. So this will be a type 2 diabetes because there is not an absence of insulin, there is a relative lack of insulin, there are no antibodies against pancreas, but because the patient's weight is so much that the pancreas is unable to create that much insulin. So these were the various types of diabetes. This gives a little idea about who needs insulin, who can be controlled with diet, who can be controlled with exercise, who can be controlled with tablets, and what is the relationship between tablets, insulin, and patients' diabetes. Now, one point to add, since we are seeing an epidemic of overweight children, it is very likely that in the future we will see many more cases of type 2 diabetes happening in younger people. Now let's see who gets diabetes. I get this question all the time. Will I get diabetes? And the answer is that there is not a simple answer. We know that insulin is required for glucose to be used by the body, and a total absence or a relative lack of insulin will cause diabetes. So it's easy to understand that for any reason, if the pancreas is damaged or removed from the body by surgery, the person will get diabetes. Pancreas can be damaged by drinking excessive alcohol over a long period of time, by certain other toxins, by trauma in road traffic accidents. The pancreas can also be damaged by antibodies, where the antibodies act against pancreas and damage it, as happens in type 1 diabetes or T1 diabetes. So any damage to pancreas causing diabetes is easy to understand. Now let's look at what other causes can cause diabetes. Depending on your genetic makeup, what sort of genes you are carrying from your ancestors, fathers, grandfathers, great-grandfathers, you may be more likely or less likely to get diabetes. Type 1 diabetes, for example, is more common in Caucasian or white people. A race called Pima Indians have very high incidence of diabetes. If you have a family history of diabetes, you are more likely to get diabetes. The closer the blood relative, like real brother, real sister, mother, father, are related by blood to you, the more the chances that you can get diabetes. So if your brother, sister, mother, father related to you by blood have diabetes, you have much higher chances of getting diabetes when you compare to your step brother or your distant cousin has diabetes, then the chances are relatively lesser. The more the number of people closely related to you by blood have diabetes, the higher the chances of you getting diabetes. So if both your parents have diabetes, the chances are much higher for you. So the genetic makeup predisposes a person to get diabetes. The next group that is predisposed to get diabetes are people who are overweight. We saw that in type 2 diabetes, there is an imbalance between the need for insulin and what the body can produce. So if the body can produce 100 units and you need 120 units because of your weight, then you will get diabetes. So if you lose weight, your requirement for insulin will decrease and your diabetes may disappear, as they call. So being overweight predisposes you to get diabetes, and we saw that example when we saw that now type 2 diabetes is happening more and more commonly in the young people because there are so many of them who are overweight. So being overweight predisposes you to get diabetes. Then if you have prediabetes, we saw the definition of prediabetes, that if you have a blood sugar between 100 and 125, you are more likely to get diabetes. Not all cases of prediabetes will develop diabetes, but the chances are more. So if your sugar is 120, it's easy to understand it can easily go to 130, compared to if it was 80, then to go to 130, it will take some time. So if you are a pre-diabetic, you have higher chances of getting diabetes. Inactivity, because it decreases insulin action, may act together along with being overweight to predispose you to diabetes. We will see that physical activity increases the insulin's action. So whatever insulin is available will be able to work better if you are physically active, and if you are inactive, it will not work so well. So physical inactivity may also predispose you to diabetes. Another group of people who are predisposed to get or who are prone to get diabetes are the women who had pregnancy diabetes or gestational diabetes. We'll talk about this diabetes in detail in a different presentation, but suffice it to know, if the diabetes appeared in the woman for the first time when she was pregnant and disappeared after pregnancy, 50% of these patients will end up getting diabetes in the next few years. So pregnancy diabetes also predisposes a person to get diabetes. Then there are some other uncommon causes, like being on certain medication called steroids can predispose you to diabetes, because steroids interfere with how the glucose is used by the body, and they are used for treating some cases of asthma, some cases of rheumatoid arthritis and other connective tissue problems. And if they are used for a long time, can either make the diabetes appear for the first time or can make diabetes control much more difficult. So to recapitulate, who is at risk of diabetes? Number 1, depends on the race. Number 2, depends on your genetic makeup and family history. Number 3, depends on if you are a pre-diabetic. Number 4, depends on if you are overweight and inactive. Number 5, depends if you had pregnancy diabetes before. And number 6, depends on injury to your pancreas, and that comes in various forms that we discussed just now. Now let's see what are the symptoms of diabetes. We saw that what we eat is converted to glucose and circulates in our blood as glucose. This glucose need to enter the cells in our body so that they can function properly, so that the brain can think, the heart can continue to pump blood, the muscles can keep moving us around. So for cells to work normally, they need glucose, and the entry of glucose from the blood into the cell depends on something called insulin. As a result, if there is either lack of insulin or total absence of insulin, the glucose will not be able to go into the cell from the blood. As a result, two things will happen. One, the level of glucose in the blood will rise, and the second, the cell will not have enough glucose that it needs, and the cell function will suffer. So the symptoms in diabetes occur because of these two reasons. Number one, because of the rising blood glucose level, and number two, because of the lack of glucose in the cell causing problem with normal cell function. Let's see this group of symptoms one by one. What symptoms occur because the glucose in the blood is rising? We know once the glucose crosses 126 milligram percent in fasting state, it is diabetes. But till it reaches 180, our body can keep this glucose inside the body. But once it crosses a level of 180 milligram percent, this glucose is spilled in the urine. The body cannot retain it anymore, and the extra glucose is lost from the kidneys in the urine. Now this glucose cannot be passed as powder, so it draws with it a lot of water from the body to make the urine. As a result, patients with high blood sugar levels or patients with diabetes pass a lot of urine. So not only they go to the urinal again and again, but every time they go, they pass large amounts of urine. Because a lot of water is lost in the urine, there is a relative dehydration in the body. There is a relative lack of water in the body. This has two consequences. Number one, the patient can feel dizzy because there is dehydration in the body, and the second is the dehydration makes the person drink more water. Now the person may be drinking water or sodas, Coca-Cola, Pepsi or something like that, but whatever, the patient drinks more liquids to compensate for the dehydration. So the second important symptom in diabetes is drinking excessively, drinking liquids excessively, mostly water. So the diabetic can have excess urination, excessive thirst leading to excessive drinking of liquids, and dizziness from dehydration. Sometimes you will see in some type of diabetic patients, the levels can reach 400, 500, 600, and those levels cause the blood to become thick like honey, and this blood cannot flow freely, and as a result there is sluggish blood flow, and this can again cause dizziness. Just as we keep a sugar solution outside for a few days, we see some infections grow on it. In the same way, if there are high blood sugar levels in our body, there are more chances of infection growing in the body. So the repeated infections in the skin present at recurring boils, or in the lungs causing recurrent pneumonias, or in the urine causing repeated urinary tract infections. So diabetes increases chances of getting infections. When the infections occur, they are difficult to treat because our defense cells, our cells which fight the infection, cannot function properly in presence of high sugar levels. So not only there is a more chance of getting an infection, it is difficult to clear the infection. For the same reason that our cells defending our body cannot function properly, even the smallest of cuts take a long time to heal if the blood sugars are high in the diabetic patient. So high blood sugar levels cause increased chances of infection, difficulty in treating infections, delayed and slow healing of smallest of injuries like cuts, etc. Also, I will draw your attention to a special type of infection that happens in women, and they get the yeast infection in vagina because of poorly controlled sugars. So if you are a woman and get yeast infections more than twice in say 3 to 4 months, it's a good idea to check for diabetes, because testing for diabetes is now so much easier. Another important and interesting symptom that I would like to talk to you about is the changes in vision in diabetes. Now there are many causes of change of vision or decreased vision in diabetes, including cataract, glaucoma, retinopathy, the damage to the retina, to the layer of the eye from which we see. But we'll talk them in a separate presentation. Right now, talking about changes in vision because of high blood sugar levels affecting the lens in the eye. What happens? We have a unique ability that we can see far away, things that are far away, and we can also see things which are very close by, like reading the newspaper, and that is made possible by a structure called lens, which is in front of our eyes, in the front part of our eyes. This lens can change in shape, and that's how we can see far away and close by easily. Now think of this lens as a grape. If you drop a grape in a very thick sugar solution, it will lose water and it will shrivel. If you put this grape back in normal water, it will take the water in and go back to normal shape. Similar things happen when the blood sugars are very high. The lens shape changes, and this change takes days to occur. As a result, when the sugars are high, the person can get decreased vision because of this change in shape of lens, and will not be able to focus far and near very easily. There is a practical importance of this fact, and the importance is, if your sugars are running high, do not buy a new pair of glasses, because once your blood sugars go back to normal, those pair of glasses will be useless. So when you go to buy a new pair of glasses, make sure your blood sugar control is good for at least 2 weeks, and then you buy the pair of glasses. Why I said 2 weeks? Because it takes about that much time for the water to transfer in and out of the lens. So do not buy a pair of glasses when your sugars are running very high, otherwise that pair of glasses will be useless when the sugar comes back to normal or comes in the normal range. And also wait 2 to 3 weeks at least. Make sure that the blood sugars are normal for 2 to 3 weeks, and then you buy those new pair of glasses. So to summarize, because of the high blood glucose levels, there will be excessive urination, excessive thirst, excessive drinking of liquids, mostly water, dizziness, increased chances of infections in the skin, lung, urine, and in females in the vaginal area, changes in vision, and decreased healing of smallest of injuries like cuts, etc. Now let's see what happens when there is not enough glucose entering the cell and the cell function suffers. Depending on where the cell is, symptoms occur. So when the brain cells do not get enough glucose, there is confusion, inability to focus or concentrate on issues, irritability, and in severe cases there can even be seizures. But confusion, irritability, inability to focus, inability to concentrate on issues is a common feature of diabetes. When those brain cells which are related with our satiety, when we eat food, some cells in the brain say, okay, you have eaten enough, you can stop now. When we are hungry, some cells say, okay, go and eat. So those cells, when they do not get glucose, they think that we haven't eaten our food, so they order our body and mouth to go and eat. As a result, those patients who have diabetes eat excessively. So excessive eating is an important feature of diabetes. If the cells that are not getting enough glucose are in the muscles, then the person feels easily tired, easily exhausted, takes a long time to recover even after smallest of jobs the person does. So easy fatigability, tiredness may be because of diabetes. When the cells in the body that are forming new proteins for the body do not get enough glucose, there is weight loss because the body is not able to form new proteins. It is using the old proteins but is not forming the new proteins. It is breaking the old proteins down but is not forming the new proteins, and there is a weight loss. This weight loss can be very dangerous because it is associated with many other problems like production of excessive acid in the body, production of other poisonous substances like ketones in the body, and excessive acid can lead to problems with the beating and the rhythm of the heart, and even can cause unconsciousness. So lack of glucose inside the cells, lack of ability of cells to consume glucose leads to serious problems including excessive eating, excessive tiredness, excessive fatigue, inability to focus, inability to concentrate, confusion, maybe seizures, weight loss, production of excessive acids, ketones, and maybe even loss of consciousness. So if you have any of those symptoms, then do not hesitate to get a blood test done for checking for diabetes, because nowadays it is so easy to get this test done. It can be done within a few minutes and you will know the answer. But missing the diagnosis of diabetes can cause serious disability and even death in the long run. So, if you have any of the symptoms that we talked about in diabetes, and especially if you have a family history of diabetes, please call your doctor and get checked for diabetes. Knowing is much more better than not knowing, because once you know the diagnosis, you can manage the condition.
This is a cell, and this is a blood vessel which carries blood. The blood vessel has blood in it which has glucose in it. Now this glucose need to go into the cell so that the cell can function properly. At the cell wall shown here in this brown circle, there is something that is needed that helps the glucose enter the cell, and that something is called the insulin. Insulin is a hormone which is made in pancreas, which is situated in the upper part of our abdomen. In conditions where there is no or less insulin than required, as shown here, the glucose cannot enter the cell and stays in the blood vessel. As a result, the blood glucose goes up as shown here, and the glucose in the cell goes down, and these two cause various symptoms of diabetes. So this is a very important diagram. This is a cell, this is a blood vessel, this is the glucose that has to enter the cell. Insulin helps the glucose to enter the cell. Insulin is made in pancreas. If for any reason the insulin is absent or less than what is required, then the glucose cannot enter the cell, accumulates in blood causing high blood glucose levels, and the levels of glucose are low in the cell and the cell cannot function properly, and these two give rise to various symptoms of diabetes. So what is diabetes? If one fasts for 8 hours where he or she doesn't drink even water, and then gives a blood test for sugar or glucose, and the report comes back as 126 milligram percent or more, it is diabetes. If the report is between 100 to 125 milligram percent, it is pre-diabetes, and if the report is below 100 milligram percent till 70 milligram percent, it is normal blood sugar or normal blood glucose values. What it means by that is that if one stops eating and drinking including water at 10 p.m., that person can give a blood test for sugar or glucose anytime after 6 a.m. next morning. Symptoms of diabetes due to high blood glucose levels include excessive urination, excessive drinking of liquids, dehydration, dizziness, increased risk of infections in the skin, urine, lungs, blood and vagina, slow healing of cuts and wounds, and changing vision. Symptoms of diabetes due to cells not getting enough glucose include excessive hunger, tiredness, weakness, fatigue, inability to concentrate or focus on issues, irritability, confusion, seizures, loss of consciousness, and also loss of weight. Now, who is at a higher risk for developing diabetes? Those who are from certain races. If somebody has a positive family history of diabetes, if somebody is a pre-diabetic, those who had pregnancy diabetes, then overweight individuals, then individuals who are not active physically, those individuals on certain medications like steroids, and any cause leading to damage to pancreas, including surgery, drugs, alcohol, cancer, and radiation. Pancreatic damage as a cause of diabetes is not very common. Now, if we look at differences between type 1 and type 2 diabetes, type 1 diabetes occurs below 25 years of age in most cases, and type 2 diabetes occurs above 35 years of age. If we look at the weight, then type 1 patients or T1 patients are usually not overweight, whereas overweight is a common occurrence in type 2 diabetes. If we look at the presence of insulin in body, we will see that in type 1 diabetes, insulin is totally absent from the body, and in type 2 diabetes, insulin is present, but the amount present is not enough. So there is a relative deficiency of insulin. If we look at if the diabetes can be controlled by exercise and diet, type 1 diabetes cannot be controlled by exercise and diet, even though the efficacy of insulin administered can improve, but the diabetes cannot be fully controlled by exercise and diet. Compare this to type 2 diabetes, where in some cases, especially in the beginning and especially in those cases that are overweight, exercise and diet can play a major role, and in some cases there may not be need for any medication. Even if the medication is started, it can be stopped if the weight is corrected. For the same reason, if we look if the diabetes can be treated with tablets, type 1 diabetes cannot be treated with tablets. Type 2 diabetes can be treated by tablets, and it may be many years before the patient needs insulin. Now, is insulin a must for treatment? We saw absolutely there is no insulin present in type 1 diabetes. So the only treatment for type 1 diabetes that is presently available is insulin injections. We saw that type 2 diabetes can be treated by diet, exercise, tablets, and then maybe insulin. One of the most important differences between type 1 and type 2 diabetes is that in type 1 diabetes, the antibodies to pancreas, there are chemicals present in the body which the body has created that are harmful to the pancreas and destroy the pancreas. No such chemicals or antibodies are present in type 2 diabetes. Sugar or glucose, which is the right term? Blood sugar or blood glucose? In practice, blood sugar and blood glucose are used interchangeably to mean blood glucose. Similarly, urine sugar and urine glucose are used interchangeably to mean urine glucose. There is really no sugar in our blood or urine. What we call sugar is really glucose, so blood glucose and urine glucose are more appropriate terms. So, what did we learn about essentials of diabetes? We learned that what is diabetes, what is the difference between the terms blood sugar and blood glucose. We learned that why does diabetes occur and what is the relationship between glucose, cell and insulin. We learnt about the role of insulin in control of blood glucose or blood sugar levels in different types of diabetes. We also learned that what are the various types of diabetes. We saw that who is more likely to get diabetes and why. We also learnt the symptoms of diabetes due to high blood glucose and those due to lack of glucose or sugar in the cells. Each of these is a separate presentation which is about an hour long, and I recommend that you review all those presentations also.